Hi, my name is Dr. Ariel Weitzman. I'm part of the Dearborn Ear, Nose, and Throat Group. We have offices in Michigan in both Dearborn and Livonia, and we are ear, nose, and throat specialists who help take care of patients with sinus complaints. Sinus disease is very common, especially in the Michigan area, because we have so many allergies and a lot of pollution in the air. A lot of our patients come in complaining about sinus pain and pressure. And we have new technology, new treatments that make treatment of this easier and better than it ever was before. The sinuses are essentially cavities inside the skull that should be air-filled and should communicate with the nose. When there's blockage and the air can't get in and out or infection forms, people get the typical pain in their face, sometimes cheeks, sometimes between the eyes, sometimes in the forehead. Way back in the olden days, which we'll say was 30 years ago, sinus surgery was very difficult and the recovery was very poor. Incisions were sometimes made through the skin on the face or through the upper lip, and the sinuses were opened and scraped out. People figured out pretty quickly that not only was this difficult surgery, but it didn't work very well. So in the past 25 years or so, we have evolved to use telescopes to do the surgery, where we go through the nostril with a telescope and we're able to do all the surgery internally. Now we've taken this technology and actually moved it into an office setting where we can use our telescopes and balloons and a computer guidance system, and we're able to open the sinuses without people going through anesthetic, and it's a very safe and comfortable procedure that has a very good success rate and very, very low complication and risk rates. So I'm going to turn this over to my partner, Dr. Lopayton, and he's going to go through the actual procedure and show how it's done in the office with our newest state-of-the-art technology.
Hi, I'm Dr. Fred Lopayton, part of Dearborn Ear, Nose, and Throat team. What we're doing here today is balloon sinuplasty. What we have is a simple dummy head to give us an idea of what we're using minimally invasive balloon sinuplasty for. We have an image-guided system that we can follow our wire as it goes back into the sinus, so we can slide a simple catheter and then a balloon to open the sinus up. So now what we're going to do, if you can see, I'm putting it in the dummy head nose. Sliding the wire back, and I've slid the wire. If you look on the image guided, you can see that the wire is right into the sinus cavity. Sliding the balloon in, and now the balloon is in the sinus cavity and opening up the natural opening, and we can gently inflate that balloon, thus increasing the space to decrease the pressure. The treatment itself takes about 15 minutes. In order to do the 6 major cavities. Prior to that, it takes about a half an hour using topical medication to numb up the nose. Typically, we can use topical anesthesia in order to make it a painless procedure. Usually, within a week, most people notice a marked improvement in their symptoms. So if you are experiencing sinus pressure and discomfort, give us a call at Dearborn Ear, Nose, and Throat, located in Dearborn, Michigan, with offices also in Livonia. If you have any questions or comments, feel free to put them below and we will go ahead and answer them for you. I'm Dr. Fred Lopayton. You have a great day.